characteristic flaw. So welcome everyone to Public Safety, and we'd like to start our agenda with an agenda. Would be good. I think first off, we're going to invite Chief Winstrom up here. I just saw him. There he is. To discuss update on monthly crime stats.
Okay, thank you, Mr. Mayor, members of the committee. Right. I know we have a packed agenda, so I'll be quick. Assessment is mostly good news again from the police department, which is good. Headed into our warmer months, as you can see, auto thefts continue the trend, which we've spoken of, so won't beat a dead horse, but we're still headed in the right direction, as you can tell. Great numbers for our auto thefts. As you can see, hopefully that line continues to go down. Robbery totals not statistically significant with numbers this size. Same story with the aggravated assaults. No patterns that we've seen. We lost 2 souls this year, and I hope these are the only 2 that we discuss for the rest of the year, because we have not had a murder in the past 2 months. As you can see, our clearance rate, detectives are still doing an excellent job, and when there are no new murders to investigate, that allows us to dedicate additional resources. So we're making a lot of progress on some of these old cases. I don't like to use the term cold case because these cases are all very important to us. We're still at about 5 recorded fentanyl overdoses year to date, averaging about 1 illegally possessed gun recovered every day. This map, I feel, pardon me, my mistake. It's only for the 3 months. We have had 1 additional shooting. So we are now up to 5 non-fatal shootings this year, and that 1 additional shooting is south of 28th Street, just off Kalamazoo. So it would sort of make this look like a sort of shotgun. No statistical significance there, sort of evenly across the city. But again, the good news is it was not fatal, and we're talking very low numbers so far this year. We hope that trend continues through the warmer months. And if you have any questions, I'll be happy to take them. But I know we got a packed agenda, so I won't be offended.
Thanks, Chief. One question that you may not be able to answer offhand, but whenever you look at numbers, I wonder year over year. So it's great that we've had so few shootings. Do you know this time last year how many we had offhand?
I should have done the year-to-year comparison, but I know we had many more than 5. And our numbers for shootings aren't great because our record management system prior to my arrival didn't record shootings, but we added it in 2022. So 23 and 24, we should have those numbers. But yes, this is definitely, I won't call it a surprise, but something that we're celebrating.
Great. Thank you so much. Any commission questions? Okay, then we'll move on to our next item. Thank you so much, Chief.
Thanks.
And we do have a packed agenda item now, so now I'm going to bring up a group that's near and dear to my heart because I was part of the inception of this group's work in Grand Rapids, but we're going to hear our first report from Just GR, which is a group that had its inception with the Aspen Institute's decision to invest in the community of Grand Rapids, but I will let the chairs talk about the project. And Brandon, if he wants to talk.
Well, good afternoon. Brandon Davis from the city's Office of Oversight and Public Accountability, and also from the Equity and Engagement Office. Excited to have the opportunity to introduce this presentation today. As the mayor indicated, this is work that the city has been involved in for some time, not only in the Office of Oversight and Public Accountability, but also across the organization. There's representatives from the police department that are involved and several other city departments. And our mayor helped to found this here in Grand Rapids. I'm excited to first just walk us through the agenda for today. So you will hear about the data and background related to this project. You'll learn more about the team, several of the members who are here today. We'll talk about the timeline, strategic initiatives, also an alignment, the alignment to city work and the community impact. And then there'll be time for questions and answers. And because we have a packed agenda, I will move very quickly and introduce you to the chairs who will take us through the rest of the presentation. We'll be hearing from Pastor Paris McMurray, who is the senior pastor of Renaissance Church of God in Christ here in Grand Rapids. He is also the supervisor of community and student services for Grand Rapids Public Schools. And we have Amari Fuller, who's the vice chair. She's the community engagement specialist for the Michigan League for Public Policy. And I'll turn it over to them at this time. Thank you.
Good afternoon, everyone. Thank you again for this opportunity to be able to present and share this information with you all. You do have, and I hope that you have the presentation in front of you. So if you have any questions, notes, whatever that might be, please feel free to write them down, and we'll get into some questions and answers afterwards.
Awesome. All right. So we'll start off giving a little bit of background about the project. Obviously, the mayor is very familiar, but you can see our mission and vision that are up on the screen there. Those were created by our Leadership Council in the last year or so, and that's a newer council that we'll talk a little bit about who those folks are. We also want to share this project is very special. It's a national initiative that was formed through partnership with the Aspen Institute's Criminal Justice Reform Initiative. Aspen's a global leader in driving change through dialogue, leadership, and action.
And so what we've done to speak specifically to the Aspen Institute, this is a 2-year planning phase where it includes the 2 years of planning and then also 4 years of implementation, right? And so what we're looking at is different areas of assistance that the Aspen Institute has been able to provide to us. You all can see governance, communications, incorporating data, et cetera. To start with our LC, our Leadership Council. Our Leadership Council is inclusive of different backgrounds and different sectors across our city. That is to include the faith-based initiative, education, public policy, mental health departments, et cetera. And so we have a vast level of experience and information, and then also insight on how to address some of these things that we're able to see. A couple of the outcomes that you all will identify and notice is that there's a shared vision, there's an agreement between ourselves and Aspen Institute to look at the definitions of what justice and safety look like. We know the importance of common definitions and common terms, and so we want to be able to kind of set a baseline and level set ourselves about some of the definitions as it relates to what justice and what safety looks like, developing new levels of governance, a set of community ownership. We want to make sure that the community owns this work. This is not just Aspen coming in and doing consulting, but the community owns this work, and then also an increased level of safety and opportunity to provide better lives for our citizens and people of our city.
All right, so you've heard us mention that Leadership Council a couple of times here. So on the right, you can see kind of our collaborative structure. This is something that we're really excited about. You'll hear us say collaboration, cross-sector a bajillion times this presentation because of how core it is to the success of the project. So on the right, you'll see that description of our decision-making structure, and then we also have that Leadership Council that we mentioned. You can see on the left side of the screen there the organizations that are represented on our council. So again, a diverse set of perspectives that we're really excited about. Next, we have our Justice Collaborative. So this is everyone else who's involved in the project. So that includes funders, that includes community members who we're hoping to have involved through focus groups, as well as community members, subject matter experts who will be involved in our data work groups, which we'll touch on a little bit later. We also have our Justice Intermediary, which is Corbel Health. So they're the backbone of this work. They're our convener. And then finally, Aspen Institute, who created the project and provides us with awesome technical assistance.
So looking at our timeline of where we've been, where we are, where we intend to go, a couple of highlights that I want to bring out. Firstly, this is a little bit of a plug, but our mayor, current mayor, Mr. David LeGrand, he initially, the Aspen Institute reached out to himself and Mr. Joe Margill. They were the original co-chairs of this collective to bring this project to Grand Rapids. At that time, we had a connection and a partnership with WMCAT to help us in the planning phase to provide some of the structure and to provide some of the leadership and the technical assistance here locally in the city. Then we moved into a planning phase where that included convening different work groups to identify different data elements and audit as well. In 2023, we were able to identify Corbel Health as what we call our local justice intermediary. Really what it is, it's our boots on the ground support so that the work of this collaborative goes forward. Many of us have have 15,000 different jobs. And so Corewell has done a significant lift for us in providing some of that structure and logistical leadership in there. In addition, we looked at governance and evaluation. We must understand what we do, how well we do. And so evaluation is extremely important for us. And then as we plan to move forward later in the summer, early fall, we're looking to look at some data analysis and do some data analysis so that we can develop what we call our action matrix and really understand what that looks like from an action standpoint as we analyze the data.
Awesome. And so we really wanted to highlight how aligned this work is with things that the city is already focusing on and working on. So that first piece there, public safety, one of the strategies in the city's strategic plan is safe community, specifically that all people feel safe and are safe at all times throughout our community. This project focuses on creating a safe and just Grand Rapids for all of our residents. This community is cross-sector. I'm going to keep saying it because this is my favorite part of it. But again, we're not looking at this just from one group's perspective or one person's perspective. We have a little bit of everybody involved. So from police to fire, nonprofit, the faith sector, education, people like me who kind of don't fit in any of those, all involved, hearing voices that are important to this project. That third piece there, we're Grand Rapids focused, so we're not looking outside of Grand Rapids city limits. We're really focusing on the city, similar to previous work like neighborhoods of focus. We're looking at neighborhood level data, and so we're able to do some really targeted recommendations and understand what neighborhoods are experiencing the highest level of disparity so that we can make those targeted, focused approaches. Saving public dollars, right? So we want to make sure that public dollars are efficiently and effectively being used, as I'm sure all of you do. So our goal is that the dollars are spent on preventing interactions with emergency response systems so that those systems are only used when absolutely necessary. And so connecting the dots. So again, remember, we're cross-sector. So through connections with our mental health support programs, substance abuse support programs, our housing system, connecting all of those things and making sure that we're supporting those programs so that we reduce reliance on costly crisis response systems, law enforcement, incarceration, by addressing those root causes. So a lot of folks ending up in those spaces that if we had addressed those root causes, we might be able to save them from getting to that point, right? So addressing those root causes before they escalate. So the project, the goal is to help avoid those expensive last resort interventions and then also promote long-term community stability. Excuse me. And then lastly there, we want to improve resident safety and well-being and wellness. Obviously, a Just GR is the focus of the project. And so again, all things that are aligned with the city and what the city is already focusing on.
So how is this project different from things that have happened? One of the first things that we did, one of the first initiatives and strategies that we utilized, we worked with different agencies, and we did a landscape scan of the work that has already existed in our city. We understand this idea of recreating the wheel, but what we wanted to do is lift all of the efforts that have gone forth up until this point. And so what we wanted to do is see what happened and not try to recreate what happened, but figure out how we can come alongside what has happened in our city, right? But how this project is a bit different is that it is not a one-off project. There are efforts and specific strategies within our scope of work that make this a long-term sustainable effort. We're going to do yearly data analysis so that we can see and figure out when and how we might need to pivot when conducting and doing this work. There's a significant focus on community engagement. Like we mentioned a bit ago, we want this to be community-led. We want community to really have a level of ownership with that as well. Additionally, there are 150 plus sets of data that we are analyzing consistently so that we can figure out what we're doing. Are we doing the right work? We talked a little bit about evaluation a little bit earlier, and this data is really going to be utilized so that we can keep this work forward and collaborative, probably for the 20th time, right? It's going to be collaborative in our efforts to continue that forward.
All right, look at that, community engagement again. So you can see community is important to this work. So throughout the course of this project, we're hoping to engage all those folks that you see on the screen there. And we're doing community engagement in a couple different ways, and not just doing a one-size-fits-all. So the first being that leadership council again. So we have a 25-person leadership council of leaders from across the city, across sectors. That's kind of that first layer of community engagement. Second, through work groups that are currently meeting, I'll talk a little bit on the next slide about what those are doing, but we are engaging folks who are on our leadership council and also subject matter experts from the community who are a part of these data work groups that are analyzing data and giving context to those raw numbers. Folks that are, again, boots on the ground that are working with people, involving them in this process. Also through community meetings, so being out in community, one of my favorite things to do as a community engagement professional, something that we're working on as a team as well. So we'll be attending community events like the Neighborhood Summit to gain insight and feedback from community. We're also planning to attend groups like this one to share about the work, again, get feedback, gain insight. Additionally, we're looking to host community meetings, again, to share with the community members about this project, get feedback through every step of this project. So when there's data to see, we're sharing with the community and getting their feedback and their context for it. All right, so we talked a little bit earlier about this data audit that we are getting to. I'll show you a timeline in just a moment. But the first step in getting to this audit is convening these 4 topic area work groups. So those work groups are already started and they're meeting through August. They consist again of leadership council members and then multi-sector representatives from across the community, including practitioners. And again, this is a way that we're broadening our community engagement and making sure that our data analysis is sound and has a lot of perspectives. So those top 2 work groups that you see there, crisis management operations, as well as jail resource use and response, they're looking at the addresses of folks who are utilizing crisis response resources, including things like emergency shelter, ER, EMS, suspension and expulsions, in addition to jail bookings, bonds, and DA warrant reviews. So ultimately, those groups are looking to develop priorities for action for neighborhoods that are repeatedly needing to access those emergency response systems and ensure efficient use of public dollars on jail and court spending. Those bottom 2 groups that you see there, neighborhood conditions and victimizations and community asset mapping, are going to look at data including like who victims are, where do they live in the city, what's their access to resources, so things like green space, housing, and education. Additionally, understanding what preventative community assets, like after-school programs, exist in community, where are those things located. So ultimately, those 2 groups will, invest in neighborhood conditions that improve safety and identify and invest in assets that prevent crime and violence.
So looking at our timeline over the next bit of time, right? So we see now currently it's May, technically, right? So in May, all the way through to November, you can see the timeline of our scope of work and some of the things that we are going to be doing. Amari already mentioned attending the Neighborhood Summit, again, to reinforce this point of community engagement and community ownership. Looking to highlight something we talked about earlier, in August and September, finalize our analytical findings report. That is going to feed us with the appropriate information as we look at what our action matrix will be. And then looking towards the fall, late summer, early fall, share those analytical findings with different community groups and residents in particular. All of the residents that exist within our community, we want to make sure that each person has a voice, and we want to prioritize prevention activities. We understand the investment of dollars, right? Sometimes the prevention of some of these crises that may exist could be a bit more cost effective, if you will, if we lean and focus in on the preventative strategies as opposed to simply interventions. Interventions are necessary, but how can we, focus our attention to the prevention of different crisis situations? And so the next steps are this. Number one, you all will have the opportunity to learn more. I know that we love QR codes, so if you want to scan the QR code, that will take you right to the website that has recently been enhanced and updated to share information about what's going on. We want to be able to connect you with any groups that are doing this work to hear about this work, all right? As we go through our analytical findings, as we evaluate all of the data analysis tools that we are utilizing, in the fall, we will return with some of those findings, and if found appropriate, there may be a budget request at that time. But again, we are focusing right now on analyzing this data, looking at what information is there, and engaging these different community groups, and that will feed and give us information about how we move forward in next steps. That is a lot of information, but what questions might you have?
Anybody want to go? If I can go first, and if anybody else has any questions, I just want to lean in a little bit. And if I could put Doug Wood on the spot here a little bit. Doug was really the initiator of this project. So, Doug, I don't know if you could jump up to the microphone a little bit, but the question of like what the justice ecosystem really means and the concept of what we're trying to get at here with the data, if you could speak to that a little bit, that'd be great. And maybe, our hope for how we're going to actually track progress using data.
Okay. Well, first of all, thank you so much. And I just want to also thank our chair and co-chairs. Fantastic job, and cannot do this work without your partnership. And thank you, Mayor LeGrand and all of the committee members today for the opportunity to speak about this work. So when you talk about a justice ecosystem, it's really exactly what our chair and co-chair was saying, and that is the fact that when you're thinking about crime, you just can't look at the criminal justice system itself. You have to think about all of the other elements, what I call interstitial elements, that are related to what produces crime and violence. So it's important that we understand housing information, education information, health information, economic information, all of that. And in addition to that, to know exactly what costs entail those kinds of factors that contribute to criminogenic risk factors, right? So it's not just about gathering the data, it's also knowing what the costs of those data are. So for example, if we are actually looking at what we call hyperlocal data, and that's data at the neighborhood level, because remember folks, this is at a census tract level. It's not just the county level, it's not just zip code level, but all the data, the cross-sector data that we're collecting is at the hyper-local level, where you can actually see what's happening at the neighborhood level. Once you're able to put all that information into what we call a justice audit, which includes not only the hyper-local data that is not necessarily publicly available, but you combine the publicly available data with the hyperlocal data and also qualitative data to get a better understanding of what's happening, then all those data are then used to come up with what we call a justice reinvestment plan. And so you can think very critically about how do you invest in those particular neighborhoods in ways that prevent what's happening in terms of contributing to violence and lessening public safety. And in terms of the accountability, Mr. Mayor, we want to be able to make sure there's a structure in place so this is done on an annual basis. So you do an annual justice audit, you do an annual justice reinvestment plan, and you think about whether and in fact the resources you currently have are being targeted in a way that is efficient and that is thoughtful. I don't know if I answered your question.
Oh, that's exactly what I hoped you would summarize for us, so thank you. And just so everybody knows, Doug flew in from out of town for this. He's a national leader on this issue, and so he's our Aspen Institute point person, and he's been involved in. Oh, the other thing I'd love if you could talk about is the national landscape, because the plan to have places where Aspen's Institute is investing, talking to each other and sharing best practices.
So, we are only working in mid-size, micropolitan, and rural jurisdictions. And the reason why that's the case is if you look at those particular jurisdictions, that's where the homicide rates are the highest. The homicide rates per capita are not the highest in LA. are not the highest in New York. It's in places like St. Louis, it's in places like Birmingham, it's in places like North Charleston, South Carolina. So our three initial jurisdictions, Grand Rapids is the first, and we've been working in Birmingham, and we're working in 20 counties in the state of South Carolina, and next year we hope to expand to 5 other jurisdictions. But we want Grand Rapids to be our proof point site, which is why we've had, significant interest from the Ford Foundation, the Michigan Justice Fund, the Kellogg Foundation, the KRW Foundation, so that this can actually be an example for other jurisdictions this size. And that's what we're really aiming for the work to be. And I might say, we can talk about this later, but some of you might have heard of Bloomberg City Lab, and we're very excited that we're in discussions right now. We've been invited to go to the next one in April of 2026, where we'll be able to show this work on a global scale, which is really exciting. And it's all to the work, your vision, Mr. Mayor, and the vision of all these people here. And I also want to say Coral Health has just been a great, wonderful partner in this work, absolutely astounding, and a great example of what a local justice intermediary can do and be effective.
Thanks. So I'll throw it open for questions, but I wanted to make sure that some of that background was fleshed out a little bit. Commissioner.
No. It's all good, committee member.
Committee member.
It's all good.
I always
Maybe you're
want to call
speaking
it
something to
commissioner.
in the future.
I think I did that. I think I did that to you last week, too.
That's all right. Nevertheless, thank you so much for the presentation, and truly grateful. And while we recognize that crime is, yes, a public health issue, and violence is as well, what strategies are being used to market within especially the second and third wards in order to make sure that we get enough input as it pertains to what you're looking for as far as the data and that capacity outside of inviting the personnel to come to sit at the table. And yes, I know it's good to have the neighborhood summit, but yet, and I'm looking forward to it. What are we doing to make sure that we get appropriate information?
I'll answer that with a story or something that came out of one of our meetings and conversations. We were having a very, very heady conversation around data analysis, around the data analytic tool. Very heady, very deep into policy conversation using very, very academic type language. And there was someone in one of the meetings that said, well, what about the granny who sits on the porch that doesn't necessarily engage with this type of work? How are we going to ensure that she feels as though she has a place at the table, right? And so it's those initial conversations that we've been having as a leadership council to figure out how we can be as inclusive as possible to make sure that all voices are there. So with that being said, we are looking at different stakeholders. If you remember back in our conversation, we talked about specific grassroots organizations. Even if you look, I don't want to go back to one of the slides, but look at some of the organizations that are involved and utilizing them as ambassadors, as we labeled them, ambassadors that may have connections with different sets of community that can really push this message forward, that can really engage as many voices as we possibly can. So really it's just leveraging the relationships that exist on our LC and within the community as well. I hope that answers your question.
City Manager.
Yep. Thank you for this presentation and the work, and everybody who's contributed to this is it's pretty powerful for everyone to come together around an issue that often divides people. So thank you for working together. I had a couple of infrastructure questions, and remind me. I may have missed this part, but the Leadership Council. Remind me who's part of the Leadership Council.
I'll go back to the slide. Give me a second.
Yeah. So
this is the community engagement piece. So this leadership council, so it's inclusive of all of these that you see on the left, right? It includes 61st District Court, American Civil Liberties Union, et cetera. You can read that list there. So that is the makeup of the leadership council.
That's what I want to ask, because I see Kent County Sheriff Department listed specifically in multiple jurisdictions of Kent County, but I don't see Grand Rapids Police Department listed. Are they part of the Leadership Council?
So they do have a presence, yes. Yeah, they do have a presence
Just
on
not
on the
specifically
LC.
listed on this one. Okay.
It got missed.
Okay.
They've been there since.
Yeah, since the beginning, since the.
Well, I know they've, I just want to confirm participation, especially when I see the county sheriff department.
I think that
Secondly,
counts as a typo, yeah.
Secondly, regarding the funding, this intermediary implementation has had over the 4 years, and I know there's a lot of community partners that have done. About how much does this study cost in aggregate? And then I heard the expectation to do it annually. So what does that look like in terms of supporting or resourcing to make sure this happens annually?
Yeah, sure. Yeah, so we'll let Doug speak to that, yeah.
Yeah. So if you think about the annual cost of it, it's around $250,000 a year. But then once we have the justice audit framework in place, then you get economies of scale. And our technical assistance will lessen in terms of the actual dollars. But what you need to constantly have is to make sure you have the resources for a project manager, the resources for a data manager, and the requisite resources to be able to support the annualization of this on an ongoing basis.
And I just would ask, and although we're in uncharted territory in terms of being one of the early adopters of mid-sized city, but was there any thought to having the audit less frequently than annually so that you can have both a measurement, actual work, implementation progress, and more time to come back and evaluate any changes that have occurred?
Well, I think we believe that it should be done on an annual basis because things change. There are challenges when it comes to the differences in the data sets over time. So it's important to do it on an annual basis. We don't want to do it every couple of years because then you're not really having a chance to look at a trend line. Because the interesting thing about it is once you look at the way we analyze the data and it's in the justice audit, we also do a statistical analysis that goes along with it. So you can actually look at trend lines neighborhood by neighborhood by neighborhood. And this is important in terms of having the requisite knowledge to be able to reinvest in those places where it's necessary.
I have a quick question, and I want to thank you all for the report. I think this is wonderful work. I work for an organization that, we are not a justice organization, but we like to believe we're a justice-minded organization. And as an affordable housing provider and an emergency shelter provider, I know that we would look forward to being invited to some of the conversations when you get to that stage in the process. I heard a brief comment, and I think no one would argue with the systemic barriers and histories that have contributed to oppression and othering and inequities. As you do these hyper-local justice assessments, and I heard the word justice reinvestment plan, what do we do when the issues that hyper-local communities are facing are so big that there isn't? So I heard they don't have green space. We can see a path forward there. Let's address green space. But in a community where housing is such a crisis right now, we're going to see over and over and over again that housing prices are too high or that there isn't enough housing stock. And those are contributing to justice issues because there's no place for people to be. My question is really, as we do an assessment and you do a reinvestment plan, how are those reinvestments decided on when so many of the hyper-local truths are finite? They're static. We can't change that issue, right? Like inflation, if that becomes the issue, we're not going to be able to fix that here in Grand Rapids necessarily from this perspective. So if any of you could take a stab at helping me know what a reinvestment plan is and how those next steps are decided would be really helpful.
Well, I think I could take a stab at this, frankly, and Doug, you can tell me if I'm wrong, but for example, if we know that flat out, we could look into like whether living in, an unaffordable housing unit where you're spending 70% of your income on your housing unit leads to stress that leads to X, Y, or Z. But I think the more fruitful place is probably going to be if you're literally unhoused, what are the odds that you then wind up in the jail. So that's kind of the kind of data that we could track. And then we're going to say, all right, well, how much money did we spend on the unhoused population last year? If we're spending $50,000 a year to incarcerate this person, couldn't we have given them support services that prevented them being incarcerated? So once you can find the actual price tag, and we know this has happened in the health system over the last few years very productively, so we're like saying one of the ways we talk about the unhoused population, the immediate benefit is they stop going to the ER every week if they have stable housing and somebody tracking their medication, for example, somebody with multiple needs. Well, there's a justice cost to having somebody unhoused too. And so if we can identify ways that we can get payback from I think that the hope is the data will show us that we can drive down our costs in our justice system related to that, not just our healthcare system, but when we know also being unhoused throws you into the medical system, then we can come up with a global cost that we are all paying for what the Aspen folks call crisis management. If we're like, things are falling apart. When things fall apart, things get very expensive. You get AER visits instead of wellness checks, but you also get incarceration instead of housing and so that's the answer is I think we're talking about, and again, having been in a lot of these meetings for years, it's government by crisis management turns out to be very expensive and not very effective. So it's not going to be focusing on how can we make one-bedroom apartments more expensive, more affordable in Grand Rapids. It's going to be focusing on when things completely fall apart for somebody, that population, what happens to them. And so that's, I think, where I hope the focus of the data is going to be is spend your money over here because you're already spending money over here and you can save money by doing this instead of doing that. So it's less likely, honestly, I think, going to be green space evaluation because it's really hard to track how park size relative to crime rates. Like that's a really messy, and I have a hard time imagining you could come up with some satisfying answers to that. Whereas being unhoused relative to your incarceration rates, that's easy to track. But you've got to be able to have your jail talk to your homeless shelters, and so a lot of this is making sure that these multiple groups like health systems who are doing some of this work are talking to groups like the probation department or talking to, the district courts and like assessing whether fines and costs are effective or whether that makes you homeless and you come back. So I think that, Doug, I don't know if you want to add anything to this, but like the global idea here is use our money efficiently because we have finite money, get us better outcomes. But the more acute the problem is, the more we can effectively find solutions probably. It's going to be hard to find solutions for, why does the orthopedic surgeon, have a domestic violence arrest? That's going to be really tougher to get data on than why does being homeless throw you into the justice system.
Well, Mr. Mayor, I think you're absolutely right. I really can't add any more to it because you hit it right squarely on the dot there. I will just remind everyone that out of all these data sets that we're collecting, there is a cost index applied to every piece of data in the justice audit. That's the only way we're going to get to really understanding whether we're spending money efficiently and also thinking about how we can spend it more strategically. It's not about more money necessarily at all. It's really about how do you reallocate and target more efficiently and strategically. So, for example, every time someone gets shot and goes to the emergency room, there's a cost to that, right? Every time a kid drops out of school, there's a cost to that. So it's important for us to capture all those costs by every individual piece of data in the audit itself to be able to have a thoughtful conversation and to think very critically about justice reinvestment.
Yeah. Just one more. Since this is a very public conversation, I just want to be clear. I'm anticipating and looking forward to the data, but I would hope that we are not only talking about reinvestment, there may need to be additional investment because I don't want this to be a report that says, in order to do this, we have to take away from this area in order to fund that. And at times that might be appropriate, but I don't want that to be the expectation that it requires a defunding of one service to fund something else.
No, I mean, obviously, when we get to the reinvestment process, then there could be a question about where additional resources might be needed. So, it's not just about moving the deck chairs. so to speak.
Thanks. And yeah, the question of how to spend our money more efficiently, we're going to be able to get more progress. So, for example, if we could do warming shelters and resources we already have, and it's, really stopped some of our justice costs, that'd be great. On the other hand, we may need to build more warming opportunities for people in the community. So I'm glad, City Manager, you're feeling the excitement here.
Yeah, I'm open to both. I just want to make sure we're looking at everything, both reallocation as well as additional investment.
Commissioner Kilgore, I can call you Commissioner, right?
Yes. So I just wanted to thank the Just GR team for their work, and I'm looking forward to hearing more on it. And I had a question about your marketing and social media outreach. So you'll be at the neighborhood summit, and you're doing outreach to these groups. One of an efficient and effective and often lower cost outreach strategy is social media. And as youth are one of the frontline communities that you'll be tapping into and getting data on, I'd just like to hear more about your outreach for that group of folks.
Yeah. Yeah. Yeah, I know you could. I'll tap you in. So I think the social media campaign is still growing. So this is really like our first couple launches of this publicly. Social media will grow from there. We've had a press release come out. And then I think the way that we are approaching all of our community engagement, and even with youth, will be through trusted messengers, right? So like bringing folks on to that Justice Collaborative, to our LC, who are representative of those populations. And we have talked a lot about having more youth representation on the LC. Right now, I think I am our youth in the 20s. But we're definitely looking to expand that, inviting those young people to be a part of this conversation, and then hoping that they'll share that with their friends. But I think I agree, social media is a really important place for us to move into. Anything to add?
And just briefly, I'm sorry, but just briefly, we have partnered with a local marketing consultant firm that is looking at all of the different media outlets that we might be able to utilize. So there have been radio spots, there have been television things to be in consideration as well. So really looking to utilize, again, and leverage all of our different platforms where we can tell as many folks as possible.
Wonderful. Thank you.
Yeah, for sure.
Marlon, you want to go? Mr. Fine.
Thank you very much for your work. It's very intriguing and seems comprehensive, especially working with the Aspen Institute. Gives a lot of credibility. In fact, I was drawn to the words here, powered by the Aspen Institute and Justice Governance Partnership. It's pretty powerful. Is that implying bringing funding along the way after the result? I mean, after the study is done? Because there have been a tremendous amount of efforts put out over the last 3 decades on lots of issues that we're talking about, housing, homeless, et cetera, and sometimes we just run stuck without money. So this is very hopeful. What further comment could you add about that?
Well, I mean, it's going to be important that not only to leverage private funding, which is what we have right now, but also public funding. Because if you want long-term sustainability, the public institutions have to invest in it as well. If you look at the research done on similar projects, most projects aren't as comprehensive as this, as Amari and Paris talked about. But if you look at those that are sustained, for example, the Newark Collaborative that's in Newark, New Jersey, it's sustained because the city of Newark has invested in it over time. So we can't get away from the public investment part of it as we think about this long term. So.
Thank you. I'm very attracted to the word efficiency because there are several efforts that have taken place already. But we really, I think, would be a very open community to more the data-based broad study that relates to other communities, and I think you've chosen a good target.
May I say that you echo the chair of the Jefferson County Commission, by the way, which is Republican-controlled, and who invested in it for that reason. Because they wanted to have a better understanding of how they could be more efficient in terms of the dollars spent when it comes to public safety.
So thank you all. Thanks very much for the presentation. Excited by the next steps here, and I know you will be you're going to have a reception for anybody who wants to keep talking to you in room 901, is it? Or it's right here. Okay, so when we're done, anybody who is excited to talk with these folks, don't waste Doug's plane ticket on 2 minutes worth of a conversation at the mic. So they'll be here afterwards. So thank you all so much.
Thanks. Appreciate it.
Now we're going to move along to an update from the HOT team, which stands for the Homeless Outreach Team. Chief.
Good afternoon. Brief update today on our homeless outreach team. Transition, I don't know if that's the right word, maybe it should be enhancement. But the theme that I'd like you to take away this afternoon is similar but different. Similar but different. So let's go back to the beginning real quick to understand how this team evolved. I'm sure we all remember the pandemic. There was a lot of uncertainty. A lot of disease was spreading throughout our community, and the fire department responds to medical calls, and we were starting to see a disparate impact among people experiencing homelessness. So Chief Lehman at the time said we need to put together a team to go out and work on education, sanitation, and really mitigate COVID as best we could. And we worked with shelters, we worked in the homeless community, and I think we did a really, really good job during uncertain times. That work continued after the pandemic though, and we started to take on a different persona. And we did establish relationships with a lot of business communities downtown during the pandemic, a lot of other agencies, and eventually the police department joined in and we partnered with Network 180. And we had quite a team going for several years. The current state, police has given us a liaison. Sergeant Howard does a great job in the downtown district, but when they had a few people retire and move on, they moved off the HOT team, but still provided resources. And it was down to the fire department and Network 180. I became chief right at 2 years ago, and it was that was the model when I walked in the door. We focused on a lot of other areas, but we were starting to see the end of the tunnel with our current model with fire department staffing. The 3 members on that team are nearing retirement. One person moved over into prevention, and we posted twice. And out of 232 personnel, not one person wanted to join that team. And so we started to explore options how we could potentially still provide this type of work as a city, but maybe not in the fire department. So we did look at transitioning this, as city manager mentioned this morning, over to community development, where the city's homelessness coordinator resides. But for a variety of reasons, with staffing, shift work, and different things, it was decided right now the fire department probably is the best spot for this work to continue. We're well versed working out in the streets at all hours with anybody that lives, works, plays, or resides in our city. And we're very comfortable working out in the streets. And so the work is going to stay in the fire department. Now, I said similar but different. Here's where the changes are going to come in. The hours are going to change. Currently, we are Monday through Friday, some Saturdays, but with staffing, it's kind of sketchy. 6 in the morning till about 4 in the afternoon is what you normally get. We are switching to 24-hour coverage. I know that might sound odd to those of you that don't work a shift schedule. For the fire department, 24-hour shifts are the normal. It's very unattractive to come off 24-hour schedule and come to a day job like I have. So we are going to shift to 24-hour coverage. We also are retooling the Network 180 staff and realigning a little bit there. We're going from 5 down to 2 social workers, and that's going to be Monday through Saturday with those shifts. So you're still going to have a fire department captain or lieutenant in a red car. You're still going to have a social worker, and we're still going to be out in the community every day doing homelessness work. And the other benefit is, when that work is done, it's never done, But when we've hit the goals for the day, we're going to fold in some medical work as well. So we just heard about repeat users and drains on systems and different resources. I'll give you 2 quick examples of what exactly we're going to be focusing on. And I do know that Catherine's Health is starting a program this summer. I do know that MSU has a street medicine program. And those may or may not target my customers who call 911. So we have someone on Sheldon Avenue who has lost their spot at the dialysis clinic. We are now going there 3 times a week with a fire truck and an ambulance, transporting them to the hospital so they can get emergency dialysis. That's exactly where my medical outreach team can take a casework approach, leave the big red truck back in the house, and work this case to fruition and get this person back into the dialysis clinic. This morning down on 43rd Street, our new station's not open yet, so engine 12 didn't go. Engine 4 went from Kalamazoo and 28th down to 43rd Street. Mental health problem. This is exactly where either police co-response or medical outreach team need to be involved, not sending the big red truck down there about 3 times a week to this individual. They don't need a fire crew to show up. They need someone to walk alongside them to get the proper resources. You are going to see a blip in the radar as we transition with staffing. The go live is going to be June 2nd for 24-hour staffing, so it's happening quickly. Currently working with Network 180 to select and onboard our 2 new social workers. And in the meantime, my executive team, myself, and whoever else is going to be out in the mornings making sure people are still getting the resources they need as we spool this thing up. You can see our medical calls. We go through this every year with our annual report, about 17,000 medical calls a year. This is why we need to start folding in the medical outreach versus simply the homeless outreach. It's an expansion of our services. And the final slide, similar but different. The continuum of care, police co-response, our fire team, and other city departments. We must continue working together. Everything we do overlaps and intertwines with each other. And I think the big thing you're going to see is the homelessness work is going to continue. PD is going to continue with co-response, providing a liaison. Continuum of care is going to continue working on housing, and other city departments are going to continue assisting with cleanup and system improvements. So there's a lot more similar than different. But city manager and I felt it was very important to bring this to you, as this is a change into what we've become accustomed to since during the pandemic. So with that, comments from manager, or certainly any questions, comments, or concerns from everyone else?
Do we have anyone from Network 180?
We do.
Today?
Yes.
Okay. Come on up. I just wanted to thank Network 180 for the partnership. And while we transition, just out of transparency, isn't there a period where we will be without a partner from Network 180 until, was it June?
June 2nd is our target.
Yeah.
Yes, thank you, City Manager. I'm Kristen Spikerman. I'm the Chief Clinical Officer at Network 180. So we're working closely with Chief Brown and his team to kind of redesign what the team looks like and figure out what type of social workers we need on that team for this different work. And then we'll be creating job descriptions and hiring for those social workers. But there will be a gap because the social workers who were on the team have now been repositioned into other Network 180 positions.
So essentially, the team will remain, but the personnel will likely be totally turned over from the hot team currently?
So 2 of the 3 members indicated that they want to stay. So Captain Waldron and Lieutenant Kelly have indicated they want to move to the 24-hour schedule, which leaves 1 opening that I'll be posting for soon. And hopefully with the 24-hour schedule and a little bit different scope, I'm going to attract someone that has a real passion for community health. Yeah, that's the goal.
So Does anyone else have any first questions? So looking at your last slide, if you can put it up again, your Venn diagram, so that we can see that. There's conversations happening around question in other cities around police co-response is good, but then the question is, are there some cases where you don't need the police at all? In other words, a solely mental health response. And I see the couple examples you gave sounds like, in a sense.
That's already happening, but yes.
Right, but in a sense, that's then what we're hoping that the HOT team will be able to, they'll be that piece of the puzzle. If so, we probably should have some continuing conversations around whether we've got the capacity to really do a totally non-policed response to things, and not simply a co-response, but a sole mental health response. And that's one thing that jumps out at me of this model. The other thing is, all of these people Venn diagramming around a space is one way to look at it, but another concern I would have would be that we keep committing to cross-training, for lack of a better way to put it. So I know when I went out with a HOT team a year ago, lots of contacts with folks in the community. I don't remember any conversations where folks were referred to housing resources. And and certainly that wasn't lack of goodwill and good intentions on the part of the HOT team, but making sure that we actually have, I mean, it's great that continuum care exists, but if the frontline providers of services are also the frontline providers of information, want to make sure that we have conversations about making sure that the folks who are having those conversations are really able to and expected to really be honest about next resources, where to go from here, do ongoing case management. Because, I mean, a poignant example, I remember I was out with the HOT team and we were at this tent, and the person we talked to was so excited. They're like, I've got housing. And what they meant was, I have a Section 8 voucher application in. And I felt like saying, I know that your application to get a Section 8 voucher is not going to get you housing this week. And, the people on the HOT team kind of knew that, but there wasn't any here's who you actually have to talk to. Here's so coordination with the 100 efforts and the people who are really going to be able to do the work to get those folks housed. I think we've got work to do to close that gap on making sure that there's not just a wellness check, but make sure that the wellness check gets us a referral into next steps for stability. So I know that's a little bit of a statement, but.
No, I'll just say agreed. And that's why it was good timing for us to take a step back, look at the current makeup, the current staffing, and really take that next step forward. We're going to rely heavily on community development, rely heavily on Network 180, and we've done a great job building relationships. It's a little odd for us. We haven't done a great job with actions, and we're very action-oriented at the fire department. So that's why, going back to a 24-hour model, I want to make sure that our officers are taking that next step and getting the referrals done, not simply talking about it multiple times.
Yeah, and I know the folks involved in this are going to be all about this. I think it's just a matter of whether we build a model that lets people help the people they want to help as effectively as we can. So, thanks. Anyone? Yep, go ahead.
Thank you. I appreciate the presentation, Chief, and I am excited about some of the additional coverage that this will bring to a vulnerable population in our city. I joined this committee after the HOT team existed, and it was soon after the personal property enforcement was a hot topic here. And as a homeless employee, as a person who works with families who are experiencing homelessness, I'm really passionate about it. So going from HOT to MOT isn't super exciting.
That's not a great name, but.
It's okay.
It's all we can come up with.
It's okay. But the focus on a homeless population, which is rising, and I know that we're all doing great work, but I work at an organization that tracks this daily. Family homelessness is rising. We don't have enough units already, so we do have very vulnerable people, especially vulnerable children, living in places not meant for human habitation. And so it's the relationships that the then HOT team was trying to promote so that they could advocate for that community, so they could educate that community on what does it look like on the personal property rules, what are the rules and how are they enforced, and what happens when you need to put your things in a locker and how do you get those back, and why aren't tents allowed, but why are they not thrown away? The difference between personal property and refuse and rubbish. These are big conversations that ironically have a justice intersection. We just heard from Just GR. And I want to make sure that as you're increasing wonderful services, that we're not losing a focus on a very, very important population of people who are at the biggest risk.
Yep.
Especially for families with children who don't want to call and let people know that their kids are homeless today. So I'm just nervous as a team that went from like, we are here, we are called homeless, we are for these people, to we are the fire department showing up and we are here in case you have medical needs. Mm-hmm. Just the nuance of perception is very different and alarming, but it is not an attack on you or the department's efforts.
Yep, homelessness is still at the core of the work. We're folding in the medical. That we run on so many people experiencing homelessness that have medical issues. This was a natural fit to take that one step further and help them navigate the health system as well.
It makes sense to me and I support it. I feel like we need to really beef up communication as we help the people that are paying attention to this understand why this is better, because just the acronym feels like you're taking away from a group of people who need the most help.
Understood.
That's my opinion.
Thanks for that comment. Okay, thanks, Chief. We're going to move on to an update from Deputy City Manager Behrens on public health and safety measures, which is sort of like a crime report, but on things that are adjacent, which seems to be the theme today. Intersectionality.
Thank you. Sorry, and I'll be brief. I do want to take a step back and remind folks this has been a conversation, and this particular update is something we committed to in 2023. Because your agenda was so packed, this is really just the data, but I do want to take a step back and put the frame around it. Really, when we talk about how we are investing in the community with respect to the unhoused, it's really a three-legged stool of investment in facilities, investment in services, and then education and enforcement of community expectations. And we happen to be focused today on the last piece of that, but I don't want people to lose sight of the fact that we do have things going on in all three other avenues as well. We are in the tail end of the fiscal year 2026 neighborhood investment plan run through the Community Development Department, which is a lot of investment in both facilities and services that target the vulnerable in our community. And so please take a look at those presentations when you have a moment. Dialing in, again, in May of 2023, the city adopted some additional measures around and codes around particularly personal property. And so we committed to coming back and reporting out about our experiences with those ordinances, as well as with just generally speaking, how we are doing in the community in terms of responding to homelessness. So here we have the data of 311 calls. We do report out on those 311 calls. As we, you can't read this hardly at all. My apologies for that. But this is the fiscal year 2025, Q1 and Q2. So that is July through September of 2024, and then October through December of 2024. If you see 311 continues at a pretty healthy pace in terms of receiving calls that have some relationship to homelessness, the unhoused, or perceptions about homelessness and unhoused. So more than 90 calls each of those quarters. And then we broke it down a little bit more. they cover the spectrum, so it's hard to provide buckets, but the next highest piece of that, kind of the bucket about that, is a caller reporting an encampment, so we continue to see those at relatively steady levels, and then somebody seeking resources. And then there's the other 50 of those calls that aren't in one of those buckets, runs the gamut, including people asking how to redeem their property that may have been impounded. Mayor, you had asked for this year-over-year data. I didn't have a chance to put it in the slide because I'm not that proficient, but we are seeing still an uptick, as Mr. Davis talked about. So in fiscal year 24, our numbers were 80 and below on total calls, and kind of proportionally lower on those other buckets as well. Then we've got some code compliance data, and again, those are around the same as we saw for fiscal year 24. So I won't belabor that point. We do also maintain data through our homeless outreach team in terms of their contacts. So the context here is telling you kind of how they would characterize the contacts they had with folks in the community. This is based on, again, Q1 and Q2 data. The overall contacts, so just without categorizing them, Q1 was more than 1,800 contacts out in the community, and Q2 was almost 1,200 contacts out in the community. Again, compared to year over year, it's a little bit of a mixed bag in this area, so we kind of go up and down, bounce around, but we're always in that 1,500 slot. And then you can see the other data points here. So to Chief Brown's point, a lot of interaction with medical community, so a lot of support for folks who interact with Catherine's Health, who have really leaned into the street medicine and medicine for the unhoused space, and are continuing to expand those services. The team was equipped to do and is equipped to do coordinated entry assessments, so you see those there. So they are not in every 1,800 contact, but they are trained and do those assessments where needed. They continue to support and spread the word to and educate businesses about what is and isn't appropriate. So sometimes we do just have tension in the community about what is appropriate and what is allowed, and sometimes folks feel that something that is allowed shouldn't be allowed, and we have to go out and do some education about that, and then we help folks kind of be comfortable with having those conversations. SUD is substance use disorder screening, so there's, again, a medical connection there, and some of the support that was received through Network 180 and counseling and support for people dealing with such issues. And then the last is jail and emergency department diversion. So again, that would go back to some of the same themes you heard from Adjust GR. Where do we invest our funds, and can we see systems savings elsewhere? Just want to touch base again on reassuring this committee. This was a big point of contact as we were rolling out the ordinance about personal property and how much personal property was too much property in a public place. So we talked a lot about our cross-departmental training. I just wanted to affirm for this group that we do maintain these materials in a shared location. We kind of, this time of year, we'll begin the habit of, we're getting to the warmer months, we're getting to the places where people are kind of living outside more, are moving around with a lot of their things outside more and in public places. So let's refresh staff. What are our rules? How do we implement those? Where are the resources that we need to provide the noticing? So again, we went over this in more detail at a prior presentation, but we have this kind of flow chart that helps our staff assess how the ordinance may apply to a given situation, and then how to execute on that as well. And then we have the investment, and the manager, I think, touched on this briefly with the budget, but we did have an investment in some of our public works staff as well. So we grew the team to be able to provide some more on-demand or ad hoc cleaning services to support the personal property ordinances. So again, you can see here kind of where we tend to have HOT and Public Works deployed together. The commitment is to educate the public about what is allowed, and so HOT comes along and does that, and then Public Works will come along after and either dispose of or impound the materials based on that flow chart we had in the prior in the prior slide. And then just to keep it interesting, this is calendar year 2025 data on this slide, not fiscal year as the prior years were. But this is just reporting out again, Public Works, how much time they're spending supporting this effort. Data around what they have disposed of as well as what they've impounded. Impounding continues to be relatively rare and still seeing the difficulty in getting either lack of interest or difficulty in folks getting that property back. So you see we impounded 4 items or carts, and none of those were redeemed in the last period. So we'll continue to evaluate and are always open to our partners who work with this community as well. If there's things that we need to improve that in particular, we're always open to that. So with that, that concludes my report.
Thanks.
Happy to answer any questions if there are any.
Any questions? I found that flow chart very useful. Is that getting out to businesses? Because that's just generally a useful flow chart to see.
We have provided it to some of our kind of community service partners so they could also help educate, but certainly happy. Tammy Vincent tends to support our businesses a lot, and I can certainly follow up with her to make sure if she feels it's appropriate, she can share it in any time.
I mean, it might give them the ability to be like, oh, I see an ordinance violation, or no, this is not.
Right.
But I thought it was a very good flow chart. Thanks.
Thank you.
Any other questions? Otherwise, we'll move on to parks. David, want to come up and tell us what's going on in the parks this summer? He says, tell you to be quick because we have one more presentation.
Who said be quick?
The good angel sitting on my right shoulder.
Oh, okay. Let's see if I can find it here.
There you go. Here, right there.
Oh, thank you.
Yeah, just double click on that. Sorry, I left you hanging, man.
All good.
All right, there you go.
All right, good afternoon, everyone. It's a pleasure to be here to share with you this annual update on park and recreation activities that take place to supplement everything that you've been hearing here this afternoon. To kick things off, we do open our pools up here very shortly. June 6th is that date. We will be open 6 days a week like we normally are. Hours generally from 12 until 7 every day with a little bit of a condensed period of time on Sunday afternoons. We've got a little bit of a new pool membership structure this season that we are giving a try. You may have heard a little bit about it in the media. We are offering at no cost pool memberships to Grand Rapids youth ages 17 and younger, as long as you sign up before June 6th. After June 6th, there will just be an incremental cost to that pool membership of, I think, $3 for the season. We are trying to make this a very low-cost point of entry for the residents of Grand Rapids. Day one, when we opened up registration, I think we had well over 1,000 kids sign up for this pool membership. So we're very excited that this is going to be a popular item this season. In addition to the pools, we've got our 4 summer day camps at the locations you see here on your screen. Those camps run Monday through Friday, June 9 through August 22. These are 4-hour daily camps. We are very excited to be well over 500 participants now with this being our 7th year of these 4 campsites. In addition to the pools and summer camps, we've got a number of summer activities. We kick off our free summer outdoor fitness series on May 12th. That's coming up here very quickly. We offer 16 classes per week in various locations throughout downtown. You can see some of those images on the right-hand side of this slide. And we've continued to see really great growth with these classes, approaching 1,000 participants over the course of the summer months. We have always done $5 kayak rentals, historically out of Canal Park. This year will be Riverside Park. Canal Park, if you've noticed, is under construction and will be for the duration of this season. These rentals take place through the end of May through the end of August, ages 10 and up for these kayak rentals. Another great supplement to that, we offer our free family paddle nights up in Riverside Park. These are wildly successful and popular events. I love volunteering at these with our staff to make these a great success, and it's so inspiring to hear families that have been, one, never been up to Riverside Park, and two, that come back in from their time out on the water and say, I could spend all night out there. We know we're doing the right thing when we hear things like that. Park security measures, again, for the 7th season, we will be running downtown security in some of our key downtown parks at 8 locations listed on the screen here. The hours of this security is from 10 p.m. 7 days a week until 6 a.m. 7 days a week. The patrols are here to supplement and build on what GRPD is providing in the downtown locations and be another set of eyes and ears and feet on the ground, if you will. In addition to that, we've got our Park Ambassador program. We've got 2 ambassadors that are out within our park system 7 days a week, roughly 5 to 7 hours daily. Primarily, we are focusing their attention on parks where we've got events that are occurring, where we've got family shelters that are being rented, and helping us to lock up our restrooms at the end of the day as well. In addition to that, we continue to train all of our staff through emergency action plans that we have put together for all of our camp locations and our pool locations. We will continue to work with our emergency management office to build out EAPs for all of our park locations, focusing on areas where families are and where park rentals take place as well. In addition, we provide all of our staff with inclement weather training, what to do in case of a storm warning or tornado warning, and where people should be going. And then briefly to close out, I just wanted to highlight a couple of things that Mr. Davis will be presenting on at a future Public Safety Committee meeting. These are Night Quest, City Vibes, and esports events that are taking place over the course, I believe, of this next season. And you should look forward to hearing more about that from Mr. Davis at an upcoming meeting. So with that, I will open it up for questions.
Thanks. Any questions, Commissioners or committee members? No? Thank you, David.
I just want
City
to
Manager.
just commend Mr. Marquardt and our community partners. In the past, we've done a lot of daytime summer programming, and so now we will have both daytime and nighttime to properly engage our youth. So thank you.
Yeah, I think that's a really great idea. So thanks.
Thank you.
Thanks, David.
This moves us on to our last update, and that's from the SAFE Task Force and the programming they are going to do.
And I will be quick. So the SAFE Task Force is a task force that was established in 2015, and what it mostly does is try to find grassroots opportunities for the community to come up with ways to combat violence in our community, specifically gun violence. And again, this program has been going since 2015. There's multiple examples of partners that have partnered with the city and grown to bigger and better things, and I'll show a little bit more of that in a moment. So here are the current members of the SAFE Task Force. Again, I will be quick. You can see that information there, but it's also on the website. And the way that the task force funds these violence prevention opportunities is mostly through pitch and highlight nights, where community partners have the opportunity to pitch their idea. They have 5 minutes to show what they think would help to eliminate that violence. And then also towards the end of the year, we do an RFP, which is calling for additional opportunities, and the task force uses the year's work to educate them on what might be offered, along with the, along with the police department strategic plan, the city strategic plan, and OPA strategic plan. Again, this next little piece of information is on the city's website, but we have a number of programs that are happening this summer. As the city manager said, in the past, we've focused, the city has focused on programs during the day, but through OPA's programming that'll be, I believe, talked about at the next public safety meeting, and some of the programs that we have here, there's more opportunity for alternatives for young people at night. So we have this program by Mirror Me. They look to combat the ACEs, which are adverse childhood experiences for young women especially. We have Clean and Sober Support. Many of the members of this group are formerly incarcerated persons, but they're on the right track now, and they look to give back to the community and young people specifically, again, to find opportunities to help them make better choices. Jump Ahead LLC, DeAndre over there is partnering with us on that, and also with some other people. But that's to I think this is a very innovative program right here. This is providing young people the opportunity to play video games at night, specifically Fortnite. He has a way to track that through some online system. So if the kids are at home playing Fortnite, they're not downtown or wherever running amok. So I think this is an innovative program, and I wish them the best of luck on that. And then we have Epic Kid Productions, which is doing a one-day program for youth. That's still in process, but that's going to be at one of our city parks, specifically Garfield Park is what we were looking at. And then next we have Next Gen Arts and Technology. I'm going to let him give a quick update on his program. But in addition, we have a gathering, what we call the Safe Gathering, where we get, partners in this work that are interested in reducing violence, and we kind of come together, we get in a circle and we talk about things. These are some of the issues that we've discussed in the past that are needed. Jobs for young people, we have that through Grow 1000, put a plug in for that also. Transportation, a continuum of care. But this year, I want to just discuss that top point there, more coordination of services. And that's where the group kind of came together and said, hey, we have all these disparate activities going on. How can we kind of come together and figure out how we can be all on the same page? And if someone is interested in knowing what's going on and what opportunities there are, there's like one place or opportunity for them to know all of these opportunities. So I think this is also an example of the community working and not understanding what's best for the community. So Pastor Gaddy at Pilgrim Rest Church, he has a program called Grace. They got some additional funding from the city a couple of city commission meetings ago, and he contacted SAFE and wants access to our network, so he can use some of that funding to kind of bring these organizations together. It's still in early phases right now, but that's an opportunity to have these different hubs, night and in the day, for young people to make some better choices and get some positive word into their brains. And then the RFPs in process, we're going to use all this information, including the information that we've heard today, to come up with an RFP, and we'll do a process for that at some time in this early spring. And with that, I'm going to turn it over to Mr. Darrow here, who's going to tell you a little bit about Next Gen Arts and Technology. He's going to be very brief, because I know you guys have lots of questions.
Good afternoon, everybody. My name is Daryl Jackson Jr., co-creator of Next Gen Arts and Technology, but the program that we lead is Streets to Code It alongside my brother Anthony Williams. For the last few years, we've been right there in the neighborhoods and the schools, in the pain, building trust, relationship by relationship. We sat with families after funerals, pulled kids out the fights before they made life-changing decisions. We brought hope where there was only hurt. See, in every generation, there's only a chosen few that escaped the matrix. And when I say the matrix, I'm talking about the cycle. The one that raises our youth in survival mode, that teaches silence instead of healing, and tells our children that there's only one ending. The Streets to Code It exists to break that cycle. At the heart of our work is the street evolution map, right? We created 7 stages that mirror the journey that every kid faces in urban neighborhoods, from jumped off the porch, to the follower, to the drug dealer, to the robber, to the working man, to the businessman, and finally, the streets to code it. Our youth learn through visuals and doing the work themselves and seeing themselves in new light. So we created something to go alongside the tools, something even bigger. A movie called The Streets to Code It, where the kids don't just act, they film, they edit, they record the music, and they get to see how decisions play out in real life. The movie isn't just for them or the tool. It's a tool that will be used in school workshops, juvenile programs, and community healing. We're not just dreaming about it, we're doing it. We got over 160 youth signed up. 60 will be featured directly in the film, and every single kid got paid. We stretched $10,000 plus our own money to fund it. No excuses, no complaints, just real work. And if we did all this, imagine what we could do with real support and a bigger budget. How many lives could we change if we had the fuel that we needed? We want to thank the SAFE Task Force and the City of Grand Rapids for believing us. This is the Streets to Code It.
Appreciate that. Thank you, Daryl. And with that, I'll be happy to answer any questions.
Any questions? Okay, well, thanks, everybody. I think that ends the meeting.
Thank you.